All right. All right, we'll wait a minute for people to flow in. Good, we got 12, that's great. Ooh, 16, woo, woo, the numbers are rising. We'll give them another minute. Okay, well, welcome everybody. This is our webinar for our veteran voices, and we are really happy tonight to have three lovely people from the VA to talk to us tonight about some of the legislation that's around veterans in the last few years. And so I'm Wanda Wright. I'm the director for the Office of Veteran and Military Academic Engagement. I've been in my position for a couple years. And as we've grown this office, we really put emphasis on teaching, research, and community engagement. And Veteran Voices is one of our community engagement endeavors. We try to get experts to come talk to us about issues around veterans, to include minority veterans, women veterans. We've done things about education. And tonight we're going to talk about some of the legislation that can really help with healthcare for our veterans. So tonight we have with us Rhonda Bentley, Irina Regas, and Kathy Farrar. And I will let them introduce themselves. Rhonda, you can go first.
Good afternoon. My name is Rhonda Bentley. I'm an 11-year veteran of the U.S. Coast Guard. As a damage controlman, I separated as an E6 in 2009. My role with the Phoenix VA is a supervisory program specialist, aka the consult manager and vendor relations manager for community care. If I'm not in the office overseeing the community care consult process or speaking with our community providers, I am out in the field attending outreach events and veteran stand-downs throughout the Phoenix VA catchment area, sharing information on the Mission Act of 2018 and community care itself. We specifically do a lot of these outreach events out in our rural communities that we serve. I am happy to be a panelist today, and I look forward to all your questions. Thank you.
Thanks, Rhonda. Irina.
I'm Irina Regas. I am currently the PACT Act program coordinator at the Phoenix VA. I'm under the suicide prevention program. I've been with the VA for about 8 years, started in Florida where I'm from, then moved to Savannah as a social worker, and now I'm here in Phoenix. Love it here, love the programs. And I'm not a veteran, but my dad was a Navy veteran. So I'm looking forward to talking with you all and answering your questions as well.
Thanks, Irina. Kathy.
Hi, my name is Kathy Farrar. I'm a registered nurse here at the Phoenix VA Medical Facility, and I'm actually one of 2 toxic exposure screening navigators. So I will be talking about the PACT Act and about toxic exposure screening and what it means for your healthcare. And I'm happy to answer questions as well. So I'm excited to speak with you, and welcome aboard.
Thanks, ladies. So we'll start with presentations before we go to our panel questions. So we'll start with Rhonda as she gives her presentation.
All right. Is my screen showing?
It is.
All right. Fantastic. Again, my name is Rhonda Bentley, and I'm here to speak about the Office of Community Care here at the Phoenix VA MC. Get my slides to change. So Phoenix VA Community Care is comprised of 195 staff when fully staffed. Of that 195, 14 are in a leadership or supervisory role, some of who are represented on this slide today. We also have 116 on the administrative side and 65 on the clinical side. So community care is not a new concept to the VA. The VA has been providing care in the community to our veterans since 1945, beginning with the hometown program up through the Mission Act of 2018. Community care eligibility is determined off of one of 6 eligibility criteria. Four of them we will actually discuss in the next slide. And then for the fiscal year 24, Phoenix Community Care has processed just under 103,000 consults and 23,500 requests for services. Oops, my slides are a little slow today. I apologize for that. 23,500 requests for services. This is for continuity of care or additional services that the veterans may need. This has equaled out to 362 million spent on care outside of the VA. This does not include claims that are still in process to be paid from fiscal year 24. So community care, of the 6 eligibility criteria mentioned in the previous slides, the 4 most common eligibility criteria seen will be I do apologize. My slides are a little slow today. Care or services are not provided within the designated wait access standards. This is our wait time for 20 days for mental health, primary care, and non-institutional extended care, or 28 days for specialty care. Or within the drive time standard. This is 30 minutes for mental health, primary care, and non-institutional extended care, or 60 minutes for specialty care. The next one is best medical interest of the veteran. This must be approved by the delegation of authority for the requested specialty. This is usually the chief of that specialty service, and they do need to approve it prior to going out. And then we also have the required care or services not offered at any VA medical center. And then we have our grandfathered veterans. These are our prior Choice 40 veterans who reside greater than 40 miles from a VAMC. So how does a veteran receive care in the community? This will start with a consult request from their primary care or specialty provider at the VAMC. This consult will be reviewed for community care eligibility based on one of the criteria listed in the previous slide. If the veteran is eligible for community care, the veteran may opt in or opt out of being seen out in the community. If the veteran is to opt into community care, the consult will be forwarded to community care staff who will proceed to contact the veteran and begin the scheduling attempts. Depending on the type of the care, the veterans can expect receiving a phone call from community care staff within about 14 days. Once the scheduling efforts have been successful and scheduled, a community care appointment has been recorded. Community care staff will send the community care provider an authorization and will inform the veteran of the appointment via mail and email. After the visit, the veteran should inform community care that the appointment has been attended. Slides are not. I do apologize, everyone. I think I'm having some internet connection issues. All right. So a veteran must report a community care emergency room visit within 72 hours of checking into the emergency room. This may be reported by anyone with knowledge of the presentation, whether it's VA staff, family, or the emergency room staff. Reporting of an emergency room visit may be completed in 2 different ways. One is by calling 1-844-724-7842. The other is to access the VA's emergency reporting website and complete the questionnaire and select submit. This emergency care reporting website can be searched via Google, and you're able to locate it that way. If a veteran does receive a bill for any care out in the community, the Phoenix VA Community Care Important Phone Number flyer will be available at all VA locations. And if that site does not have it, please let me know and we can make sure it does get out to that location. One of the most important phone numbers on this page is the Community Care Contact Center, aka C4. And this phone number is 877-881-7618. The Community Care Contact Center is able to address any type of community care billing or emergency room billing that the veteran may experience. So here's a few web links that will be very useful for yourself and other veterans that you may know. They are the VA Community Care homepage. This page will provide information for veterans, caregivers, providers, and family members all about community care, different billing, and all that kind of information. The second website is the va.gov/find locations. This page will allow users to include veterans and their families to search for any VA network provider or facility to include VA locations, community care providers, community care pharmacies, hospitals, emergency rooms, etc. At this time, I will do a brief demonstration on how to navigate through va.gov find locations. First off is to access va.gov find locations and enter the veteran's zip code. Once you enter the veteran's zip code, select from the drop-down, choose a facility type. The different facility types are VA facility, urgent care, emergency care, community providers, community pharmacies, veterans benefits offices, the veteran cemeteries, and also the vet center. Once you select the type of care or type of facility that you're looking for, in this case, looking for a community care provider, we will go ahead and type in the service type. This service type would be such as an optometrist, acupuncturist, orthopedic, so on and so forth, and select search. Once you select search, a list of available providers and facilities will populate, and you'll be able to actually scroll through there and find a provider that you may want to see. Keep in mind that when you do look for those providers, a community care referral should already be in place, and this way we can ensure that you see the provider that you would like. Then Phoenix VA does have our own call center. So for any care related concerns or questions, you can contact 602-277-5551, extension 2254. And that will take you to our community care call center, who will be able to help address your phone call. I would like to thank you for allowing me to present today. If you have any questions, please let me know.
Thanks so much, Rhonda. I'm thinking because we have a little bit of static with the PowerPoints, we're going to all go dark other than the person who's speaking, just so we can maybe conserve some of the bandwidth, right? All right. So Arena, you'll be up next, and we're going to take our video off, everybody, so that perhaps it'll be a little smoother.
Okay. All right. Do you see my slide where it says
We
Veterans
do.
Compact Act? Okay,
Looks
great.
great. Kathy, you want to, yeah, there you go. All right.
All right. So like I said, I'm Irina Regas. I'm the Compact Act coordinator. And I want to talk about the Veterans Compact Act of 2020. The Compact Act was actually enacted by the VA in January 2023. And it includes payment. Basically, this act includes payment, expands services, and gives eligible veterans access to emergent suicide care with no cost for treatment, as well as transportation related to that, the acute suicidal crisis of veterans presenting to the VA and non-VA facilities. So the PACT Act, what is it for? As I mentioned, it includes payment and reimbursement related to acute suicide care. And I want to emphasize that it will cover costs at both the VA facilities and non-VA facilities in the community, whether it's in or out of network. So we want to ensure that veterans are not financially responsible for costs associated with emergent suicide care, and then just focus on treatment so that they don't have to worry about bills and costs. It's also important, especially educating those eligible veterans who live in rural areas and are far from their closest VA. And we want them to know that even if they're far from the VA, they can present to their nearest emergency facility. And then if eligible, then we will cover the cost of that, the ambulance, any copays, including prescription copays. And one of the benefits I wanted to mention is waived copay benefits. So even if they have other insurance, or they don't have copays, like depending on their priority group at the VA, the PACT Act will pay for that. So regardless, we want to try to make the PACT Act as accessible as possible to be the main payment authority. So an eligible individual has 3 paths for initiating care for the emergent suicidal crisis. They can call the Veterans Crisis Line, which is the 988, then press 1. And after calling that and speaking with the responder, they can be transported or self-transport themselves to a VA or community care facility. They can call 911, of course, and be transported to a VA or in-network or out-of-network community facility. Or they can just simply show up at a local VA or at a facility in the community as well. So, like I mentioned, the Veterans Crisis Line they've actually shortened it to now the more easier to remember 988, then press 1. They can also chat. Here's the website that they can use /chat, and also they can text. So we try to reduce as many barriers as possible so they can reach the crisis line. So who is eligible? To qualify under the PACT Act, a veteran must meet one of the following eligibility criteria. They have to meet minimum active duty service requirements, or served more than 100 days in a combat role or in support of a contingency operation, and were discharged or released from active duty under a condition that is not dishonorable. So there are some exceptions that may apply to not meeting that minimum duty, like hardship, injury in the line of duty, receiving a service connection due to a disability, and backtracking to hardship, it could be something like a family emergency, or having to take care of, especially if they're a single parent, taking care of a child. If the discharge is other than honorable, then they can contact the Veterans Benefit Administration and ask and appeal for it to be adjudicated as honorable for VA purposes. So that would mean that during the adjudication, there's a possibility that if it's accepted and the discharge is upgraded, then they can get the PACT Act coverages. If they have a dishonorable discharge, they are typically going to be ineligible. Dishonorable, they're also ineligible for VA healthcare. There can be different variables involved with dishonorable. The best thing to do to see if it's something that they can possibly even get upgraded is, as I mentioned before, contact the Veterans Benefit Administration. We call it the VBA. They have options to appeal the discharge status, or you can visit the VA website, or go to the Veterans Benefit Administration in person. So I used to work in inpatient mental health, and I did see some situations where veterans were able to meet some of those exceptions, and we would just work with eligibility to help them out with that. It's a little bit harder with a dishonorable discharge, but I know there was, again, in inpatient mental health, there was at least one veteran I remember who was dishonorable, but there was some factors involved that could have been contributing to that, including PTSD and substance use. So I never want to not investigate any of those situations. If they fall under a possibility of an exception, it's always a good idea to contact a PACT Act coordinator, or to check eligibility, or the Veterans Benefit Administration to get some assistance. And I also wanted to cover, I mentioned that served more than 100 days in a combat role or in support of a contingency operation. Contingency operation means a military operation that is designated by the Secretary of Defense as an operation in which the members of the armed forces are or may become involved in hostile enemy territories, so of an opposing military force. So like OEF, OIF, that's one of the more recent conflicts that contingency will cover, is considered a contingency operation. So acute suicidal crisis. The PACT Act is specific to veterans in an acute suicidal crisis. What does that mean? So an individual has been determined to be at imminent risk of self-harm or unable to maintain their safety due to suicidal ideation. So that means that they're not able to stay safe on their own. They need assistance. They need to be in a facility that has safety standards. For instance, no shoelaces locked, and a lot of safety measures on the unit that will keep them safe, including 15-minute checks. So that kind of narrows down, because there's all kinds of types of suicidal ideation. So that is typically what we will cover under PACT Act. And who can determine it would be a crisis responder, such as law enforcement, health or mental health providers, typically licensed independent professionals, where it's a part of their regular duties or employment. And it's based on their clinical determination. There's no specific language or behavior criteria that's needed. It's not cut and dry, for sure. These professionals could be looking at things like their stated intent. Are there any behaviors that are almost like practicing behaviors, writing their will or writing a goodbye letter, risk factors, and active planning phase, any past failed attempts. So there are different factors, situations that would influence what is considered acute suicidal crisis. I always just say, document very, very well when the provider is treating the patient. Documenting too much is better than not documenting enough. So with the PACT Act, what are the available services for veterans? They get up to 30 days of inpatient or crisis residential care related to that acute suicide crisis. After discharge from the inpatient facility, they get up to 90 days of outpatient care related to that crisis. Prescription medications are also covered. Emergency transportation, like the ambulance transportation. And they can also contact their local VA patient advocate if they have a billing error or complaint. I definitely encourage veterans to call the patient advocate. They may get bills, multiple bills for one episode, because if they did injure themselves, self-injure, there may be a medical portion, x-ray, of course, an ambulance bill, there could be a physician bill. So the best thing to do is to contact the patient advocate so we can help you with that. We never want you to think, oh, there's nothing I can do about this, I'm just gonna, put this bill aside. We definitely want to advocate for you and help you understand that process. And some of these bills may not even show up for several months. So if you do get it, just save it, everything that you can, letters, collection letters, if it gets to that point, so that we can also, the patient advocate can also record it, and it's on file that that we're working on it. So the goal of the PACT Act is to ensure that there's no costs associated with that episode of care related to their suicide crisis, and that we reduce barriers and make sure that all eligible enrolled and non-enrolled veterans who need this benefit actually receive this benefit. So by extending the eligibility, the access, and the follow-up care, we're going to do what we can to provide that protection and help with the suicide crisis, and make that our top priority to do that by removing those barriers as much as possible. And questions we'll have later, and I'll provide my information for those who request that.
Great, thanks, Irina. All right, so
welcome.
Kathy, are you ready?
I am, though it looks like it doesn't want to let me start the video, the camera. Oh, I have to allow it. Okay.
There you are.
I didn't see that it was asking me another question to click on. And yeah, can you see the PowerPoint? Oh,
yep,
right. So I wish I could see all of your faces. Oh, it looks like it switched my camera. Okay, I'll turn my face the other way then. And is my PowerPoint still showing? So I'm not seeing it.
We do see it.
Okay, great. I'm here to talk about the PACT Act, And there's a lot of confusion around the PACT Act. So hopefully we can clear up some of those questions and things in your mind about it. And it's honoring our promise to address comprehensive toxics. So those toxic exposures that you all were exposed to during your military service. And the PACT Act brought about quite a few changes. And I'll tell you a story about one of our veterans, how it impacted his life. And, you know, stories always bring our things to life. And so I want to do that. But what the PACT Act did is it expanded and extended eligibility for VA healthcare for veterans with toxic exposures and veterans in the Vietnam War, the Gulf War, and the post 9/11 eras, and actually some Korean veterans as well. It added 20 plus more presumptive conditions for burn pits and Agent Orange and other toxic exposures. It adds more locations. So some of our Vietnam vets were in locations that weren't covered previously. Some of those areas I know we weren't supposed to be in during that war. And so those were added. And that's what happened to the Vietnam vet that I'm going to tell you about in a little bit. And for radiation exposure as well. So they added some of those locations. The PACT Act requires that the VA provides a toxic exposure screening for all of our enrolled veterans, and there's 9 million of you. We've actually done over 6 million so far in the 2 years that we've been doing it. It's hard to reach our veterans that are enrolled but aren't really, you know, seeing a provider at the VA. So we're working on finding ways to reach out to them. And like Rhonda mentioned earlier, we do a lot of events, rural events to reach out to our veterans that are far flung in the Arizona area. And you also, because of this PACT Act, it helps improve our research. There's more money for our research scientists. Yet there's more money for staff education, and you know, about the treatment that is related to your toxic exposure. So, and you might be wondering what's a presumptive condition. I mean, some of you probably already know, but to get a VA disability rating, your disability must connect to your military service. So it's not something that happens to you after you're out of the military, but something while you're in the military or related to your military service. And for many health conditions, you need to prove that your service caused your condition. You know, like you jumped out of an airplane, you had a bad landing and twisted your knee, and now you have arthritis, something like that. That would be something that would have to be proved. But for some conditions, we automatically assume or presume that your service caused your condition. We call these presumptive conditions. And so we consider a condition presumptive when it's established by a law or a regulation. And so with the PACT Act, we added, like I said, more than 20 new presumptive conditions for especially around the airborne hazards and burn pits and for our Vietnam vets. So you don't need to prove your service connection when there's a presumption. It's just assumed that you were exposed to those toxins.
Kathy, I'm sorry to interrupt you, but have you moved your slides? There we go. Okay, I just want to make sure they were moving.
Okay. So I'm going to be talking mostly about toxic exposure screening because it's the VBA, that the Veterans Benefits Administration, that would have more information regarding filing claims and things like that. But we'll talk about your toxic exposures and things like that. And of course, you all know better than I do what kind of exposures you've had, but there's chemicals like herbicides, Agent Orange during Vietnam. There's There were more than just Agent Orange, but that's the one that was used the most. Burn pits, sulfur fire in Iraq, Camp Lejeune water supplies, pesticides used during the Gulf War, depleted uranium, industrial solvents, lots of those things, air pollutants, occupational hazards like asbestos. I know many of our veterans did remove asbestos, that was in some of the buildings even that they stayed at. Even noise, loud noises can be a toxic exposure. Radiation, for our, before we knew what those exposures really did, some of our older veterans were exposed to that radiation. And then, of course, the warfare agents, chemical weapons, and things like that. Legal requirements. So, like I mentioned before, the Congress wants us to talk to all of our enrolled veterans and find out what they believe they were exposed to in the military service and get it documented in their healthcare record. And you can talk to eligibility if you're not enrolled in the healthcare. You can actually just call the main number and ask to speak to eligibility, and they'll talk with you if you're not enrolled in the VAs. And I would urge you to do so. And they will talk to you about how you can get enrolled in healthcare at the VA. So, quick facts about toxic exposure screening. It's, for all veterans that are enrolled in VA healthcare, it's really brief. It's about having a conversation with your doctor. It's only 5 or 10 minutes. They're just asking you about your exposures, what those exposures were, and, asking if you have any health concerns that you think might be related to those exposures. So really quick. It only happens once every 5 years because, now you might not have any health concerns or, issues, but in 5 years you might. So we want to make sure we repeat this for our veterans. You can get it done at any medical VA. You can get it at your PACT team or a specialty care provider as well. And the why, that's the most important thing. It's to support your long care health plan. If you want to make sure that your doctors know that you've had those toxic exposures, and if you develop a cough, they are going to look a little deeper and probably do a little more testing if they realize that you were exposed to burn pits and airborne hazards in the Middle East, rather than you're just coming in with a cold. Hope that makes sense. So we're calling it exposure-informed care. So what is toxic exposure? What is it not? A lot of our veterans think, oh, can you give me a blood test to see if I was exposed to this or that? And there's not. Many of the toxins have short half-lives. They exit our bodies, but that doesn't mean that the damage, might show up years later, like for asbestos, which we've all heard of, can show up 10, 20, 30, 40 years later in our bodies, with that mesothelioma. So, you should always report your concerns to your doctors, your providers, and have those addressed just like you would any other health concern. It's not a gateway to benefits. It's not really connected to your claims or benefits. It doesn't play a role, and VBA will mail veterans a letter if they report an exposure on the toxic exposure screening. It does not verify exposure medically or legally. VBA is the one that verifies your exposures, but you're telling us or your providers know for your health care. And VBA continues to be the adjudicating body for any claims that you might make. This one you can't see very well, but the risk, which is the war-related investigative body, they have some podcasts for our veterans, and I'll try and put the link in the chat when I'm done. But they have these, and they're very interesting. They have some doctors come and they talk about studies that are being done about individual exposures. So that might be something that you'd be interested in listening to. I wanted to just briefly mention the difference between a compensation and pension exam toxic exposure screening, and a registry exam, because it's kind of confusing, right? So compensation and pension exams, they're, ones that a forensic doctor does an exam that's requested from VBA, the Veterans Benefits Administration, when you put a claim in. So it's not for treatment. It's filled out for the raters at the VBA to try and understand the process. So it's like a bunch of check boxes and things like that. So that's part of the claims process. And the toxic exposure screening, like I already mentioned, is about your healthcare. And that's about having a conversation with your providers, your doctors, and getting all of your health concerns, really clearly, talked about and being treated carefully. And then the registry, I don't know if you've ever heard of it, but that's voluntary. And a lot of our veterans have volunteered for our research scientists to get on a registry. There's been a big change in the airborne hazards and open burn pits. It used to be that you had to sign up for it, but now they are using, the EILER records for all of our veterans, and you are being entered into that registry automatically unless you opt out. So no exams needed for that registry any longer. So there's 6 registries: Agent Orange, airborne hazards, like I mentioned, depleted uranium, Gulf War, and ionizing radiation, and toxic embedded fragments. Go on to the next one. There's some resources online that you can pull up information, lots of different things you can look at, some materials, and I will put some links in the chat for you where you can access some of those things. Cindy DeCesar and I are the toxic screening exposure navigators at the Phoenix VA. So you can call us if you have questions. And the RISC, which I said is the War-Related Illness and Injuries Study Center, has lots of great information for our veterans. There's a veteran-facing website. If you just put it in, I just Googled it, it'll come up. It has studies, it has fact sheets about different exposures. And then if you have a smartphone, I would suggest that you download this VA Mobile Exposure Ed app. See, it's green and white, has a book. When you go into your applications for your phone, it's usually the second one. It's not usually the first one, but if you put in VA Exposure Ed, it's usually the second one. It's free and it has lots of great information about exposures and dates and location areas, lots of things like that. So I wanted to show you nationally, we've performed 6,081,000 toxic exposure screens. And here in Phoenix, we've done 85,292 as of today, or probably yesterday. And then I also wanted to really quick, like I mentioned before, tell you the story about that veteran who was elderly, of course, and he had been in Laos during the Vietnam War. And so his area was not under the presumed areas for Agent Orange exposure. And he ended up getting, lots of different health conditions that were related to his exposure to Agent Orange. So when the PACT Act came about, he was able to get 100% service connected because of the PACT Act. And his doctor, he had diabetes, he has cancer, he has a heart condition, ischemic heart condition, and all of those were service connectable to Agent Orange. And so you never know, what impact it's going to have. He was on a fixed income, so it made a huge difference in his life to be able to get that, those disability claims instated, and he deserved it. He earned it, and you guys have as well. So any questions? I guess we'll go back to the main people, and I'll stop sharing.
Great, thanks, Kathy.
You're welcome.
So I think what we're going to do now is going to get a little poll going. Miss Stacy's going to put a poll out for us to answer. Hopefully everybody can see the poll. Well, I think that's most of them. So, wow, look at that. So we have 54% are enrolled and 46 are not. And so that's, I mean, that's pretty close to half, really. So we might want to, kind of look at that and see why people are not enrolled in the VA, unless, of course, we have a lot of non-veterans on here who can't enroll in the VA. Thank you for doing the poll. And now we'll start to ask some questions. Okay. All right, so what I'm going to do is I'm going to kind of go back to some of the questions that have already been answered, just to make sure that we roll over them, because obviously people had these questions. All right, so our first question is, what would I do if I got a bill from Community Care ER but didn't call the line and I'm unable to pay the bill? So Rhonda said you can still contact the 72-hour notification hotline and make that notification. I also suggest sending the patient advocate office a secure message through My Healthy Vet, or by stopping by one of the two main VA locations, 7th Street and Indian School, or 32nd Street, Van Buren, and report to the patient advocate office. Community Care will receive this report and will review for coverage. And if we are able to cover the ER vet or ER visit, we will have the claim rebilled to the VAMC. If the VAMC is not able to cover it, we will call the veteran and explain why we were not able to cover the ER visit. Are there any other questions about this particular question? Okay, it doesn't look like it. So I'll go on with the next question. Okay. You guys have a lot of questions. Okay. Next. Is the VA website down? I am not able to verify my enrollment for January. You can call and speak with the National Eligibility Enrollment Office for help, and the number is 877-222-8387. The next question is, what if I didn't get a referral to a community care doctor for aftercare from an ER visit? And then they said, in a situation such as these, coverage will be determined on a few criteria that will be reviewed by both community care clinical leadership and administrative leadership to determine if coverage are allowed or not. Please contact the patient advocate office stating you received a bill from a community provider. All right, we are seeing the same diseases in firefighters as we see in the burn pits. What about police and volunteers who are not wearing masks? All smoke inhalation is hazardous. I wonder if Congress will expand coverage someday. This is a great question. I would recommend first responders and volunteers with these concerns and issues contact their local representatives to address, which that's a great answer. We have Congress people who are out there waiting to hear from you. All right. What is a patient advocate number? Again, it's 602-222-2774. That's 602-222-2774. Somebody asked, when is My Healthy Vet going away? My Healthy Vet is not going away. They've just changed the login process to match the login to va.gov. I got my insurance through my job. Can I have both VA and my job? Yes, you may have both private insurance and VA coverage. Just be careful how they interact with one another. Ask a lot of questions. All right, new questions. Is Fort McClellan included in the PACT Act? I did my basic training there. Anybody want to answer that? Kathy, you're on mute.
Yeah, so they are doing some studies as we speak, but right now it is not included in the PACT Act, but they are doing a lot of research and on that issue, and I would keep an eye on it because lots of research and studies going on for that.
Okay. Okay.
Not super helpful, but they are looking into it.
My feeling about this is that there's going to be a lot of these come up over the next, several years. Almost every base had some kind of toxic issue, right? And so I think more and more we're going to see filings and people actually suing bases for these healthcare issues. All right, the next question: if someone is deceased but filed for Agent Orange, can the widow, and I'm assuming still make a claim? Do we know?
So, yeah, I actually asked this question. I asked it for my sister-in-law because my brother, who had never filed, was a Vietnam vet and died of lung cancer. He never smoked a day in his life, and that was service connectable, of course. So I asked one of our VBA guys at one of our rural events, and yes, now under certain circumstances, as the widow remarried, they'll ask lots of different questions, but definitely contact the VBA with those questions because even if, my brother had never applied for healthcare or service connection. And even in that case, the VBA rep said it's possible that she would be able to get some compensation if the records showed, the health records and all of that. So it could be a little more complicated, but definitely if they're service connected for that, that they died of, then definitely possible. So look into that with your VBA.
Yeah, so I'll just add to that because we have another question. My father-in-law served in Vietnam and exposed to Agent Orange. He filed before his death and it is being denied. I would recommend you going to the Arizona Department of Veterans Services, which is also at VBA. Downstairs at the first floor, they have all the people who file for disability because these are really complicated cases and you want professionals. And so take it down to those professionals and they'll get it sorted out for you. We have one other question. I'm a veteran, also have insurance through my job, but not sure how I can get access to VA insurance. VA is not insurance. How do I enroll? Can anybody answer that? How do they enroll?
Yes, the easiest way is to either go down to one of either the 7th Street main VA or even 32nd Street VA clinic down off of 32nd Street in Van Buren, and just walk in and ask to be enrolled in the VA healthcare system. That's the easiest way to actually get enrolled.
Great. I think it's a pretty simple process, right?
Yep, they'll just go through verify service. If you have your DD-214, that does always help to take that with you. And it takes about 15-20 minutes. Once you get in there, they'll take your picture and then they'll get you all set up and get you enrolled with the Phoenix VA.
Great. Okay. All right. I don't have any more open. Let me see. Any more open questions?
I have somebody that raised their hand. I don't have I have a phone number, but I don't have a name. Do you want me to allow them to ask the question?
Sure.
Okay, whoever's on the phone, you can go ahead and ask your question. And you're muted, so can you unmute? Yeah, I don't have a name. It just has a phone number,
Yeah.
so.
It's okay. Well, we'll continue on, and if they somehow can get
Okay.
through, that would be great. Okay, so let's talk about Mission Act. So Rhonda, how has the Mission Act improved access to care for veterans, particularly in rural or underserved areas? Are there remaining gaps that still need to be addressed? She's coming.
All right, can you hear me?
So yeah, I can hear
They
you.
kicked me back on mute. All right, fantastic. So that's a great question, Wanda. So the Mission Act of 2018 has improved access to services within the VA as well as into the community. As I mentioned in my slides, our access standards have reduced down to 20 days for our mental health, primary care, and non-institutional health, and the 28 days for specialty care. That means if the VA cannot see you within one of those two standards, depending on the type of care, you do have the ability to opt into community care, which is going to allow you to be seen out in the community, along with the drive time standards. So the drive time standards have also been reduced to 30 minutes for mental health, primary care, and the non-institutional care, and the 60 minutes for specialty care. So that also has improved some of the access within the VA itself, as well as being able to get that care out in the community. Now, I will say our rural areas do tend to fall behind in access to care. This is as hard as we try to locate specialty providers in our rural communities, there just aren't many available in that rural area. And getting providers to move outside of the large cities such as Phoenix to up to these smaller areas is an extremely hard ask, unfortunately. For community care, though, we do work regularly requesting assistance locating providers in our rural communities. We also work with our tribal partners in these rural communities to assist in bringing more care to these areas for our Native veterans as well out there. So it's not perfect, but we do address it on a regular basis, and we do work on building that network as quickly and as robustly as we can.
Great, thanks, Rhonda. That was a great answer. I think you're right. There still remains, gaps, particularly out in our real rural areas. And sometimes veterans tend to move out there, right? They want to be secluded or whatever reason. And so it makes it difficult for them to get the care that they maybe need, but they chose to go out to some of these rural areas. So I'm on the VA advisory committee for women veterans, and what we've suggested to the VA is perhaps they have mobile units, and I think they're starting to do that to some of the more rural areas in some of the states. I don't know if they're doing it here, to be able to get to some of the people who don't necessarily have reasonable access to a clinic or to a healthcare system. So
and that is true. So even with Phoenix, when we do go out to some of these rural communities, last year and a year and a half, between the last 2 years, we've gone out to St. John's, Vernon, Arizona, out to Kathy, remind me, a couple places all the way out into a lot of the tribal lands. So we're all over in these rural areas, these small communities where a lot of our veterans do tend to reside because it's cleaner air, it's peaceful. They're not having the stress that they have in town. The downside to that is finding specialty providers, and even with our mobile unit, getting specialty providers for some of that care does make it difficult.
Yeah, well, yes, thank you for that explanation. That's good to know, though, that they're the efforts, right? It's the efforts to try to get to people as best you can. We have a question. It's not really a question, but thank you for the wonderful panel. I appreciate this information. I hope Yuma Veteran Services increase and have all the access and services the Metro gets. They have to leave, but they just wanted to say thank you. Great. Okay. So next, Kathy, what efforts are being made to ensure veterans and their dependents are aware of their expanded eligibility and benefits under the PACT Act?
Well, National is actually putting out a lot of information, and personally, we're going to a lot of those rural events, do a lot of education there to our veterans about the PACT Act, about toxic exposure screening. So lots of different areas. There's lots of information online, and they're trying to actually reach out. There's a big push from Washington to reach out to community physicians to get the word out there that they need to be talking to their veterans about toxic exposures. And there is actually, if some of you veterans that are online here see your private sector doctors, let them know that there is training available for them. They can Google it. It's from the Risk Center, which I put the link in there, that they can get certified. There's 2 levels of certifications, and it's for private sector doctors as well as VA providers and nurses to get those certifications, and a lot of learning about all the different toxic exposures, the health concerns, the health conditions that can be related to those, and treatments, all kinds of learning, great education there. So tell your private sector doctors that it's available for them. It's free, and they can get 2 levels of certification, first level and a second level. So good to know, right?
Yeah, that's great. It seems we have a live question from Nan. She's got her hand up. Nan, can you hear us?
If she can hear, but we can't hear her, she could type her question in the chat, right?
Yeah, there she is. I see her.
Oh, I have not my hand up, I don't think.
Yeah, your hand is up.
Is it really?
Yes.
I didn't put it up.
Your virtual
Probably
hand.
I do that.
I don't know what's there.
Oh my God.
All right.
It just happens.
That's so funny. All right. Well, if you don't have
Yeah.
a question, Nan, we do have a question on our Q&A. This person says, I live in Delaware. I joined the Navy. I got out, so active duty Navy, and later rejoined the Navy Reserves. Can I still fill for disability while in the reserves?
Oh, if something happened in the reserves, I would ask VBA. I'm not sure about that, because it's usually from active duty.
Yeah, so move from active duty to reserves, but they don't say when they might have been injured. Because if they were injured on active duty, then they could still file.
Yeah, definitely.
Yeah. If they were injured on reserve time, it's a maybe.
Well, if they were in their training and got injured, that would apply. But if they, on their weekend, if they got injured on that, because they're active during that time.
Or if they were deployed for any period of time, their 2-week active duty time, I would contact the VBA and start that process that way. As far as the VA healthcare side, being a reserve, you can still enroll in the VA healthcare just during your active duty or your drill times. That would be covered by the actual Navy itself during your time active duty, whether it's your drill weekend or your 2-week, or even if you're deployed.
Yep, great answers. Okay, Irina, the PACT Act emphasizes crisis and suicide prevention. How is the VA working to strengthen these initiatives and reduce the veteran suicide rate?
So the VA, we have, as I mentioned, I'm embedded with the suicide prevention team. We have wonderful suicide prevention coordinators and case managers who are great at calling the veterans and assessing the veterans. When they call the veterans crisis line, then our coordinators call them back. We have measures in place where we measure their suicidality, if they're really high risk, and we put in things like suicide behavior and overdose reports. We put in the consults for high risk suicide, especially if they've attempted. So it's constantly a lot of moving parts, and they're very good at like after the veterans crisis call, we do 3 follow-up calls with the high-risk veterans, we constantly review whether we need to extend it or discontinue it, make sure they have follow-up care after discharge from the hospital. If they have high-risk flags, and we make sure they get the 4 follow-up appointment visits. And so that is, we consider the number one priority, is making sure that it's a very, very strong program where there's a lot of follow-up. We can't afford to miss or make any mistakes with any of these veterans if they're showing any signs of suicidal ideation. So it's definitely a team effort, and also we just want to let the veterans know too how much we care about them, and we understand as much as possible, and we want to just validate what they've gone through, and want to be there for them. So that is the communication that we have for them, and we follow up with the actions too. Oh, you're on mute.
Thanks. Thank you, Irina.
Yeah.
We have another question from the audience. Why does it take so long to get a response to the PACT diagnosis? From the PACT, diagnosis has been made along, which has exacerbated further issues. So is it taking a while to get response on PACT? Is it backed up?
So do you have a presumptive condition that you filed a claim for? Is that the question?
Yeah, there were no more details other than that.
There's not really a PACT Act claim. A disability claim is related to a service-connected condition. I think they're out. Cindy might know if she's still on. How many days they're? I mean, they're a little bit behind. There's been, hundreds of thousands of claims submitted. I think it's about 120 days now, but I could Google it and look it up probably where they're at. But there's not like a PACT Act claim. So I'm not, maybe if you could come back on and clarify your question. Does that make sense?
Yeah, they came on and said filed claim, got 10%. Now I have more service issues from burn pits, toxic chemicals, and more.
So you would file, if it's for the same thing and your condition has gotten worse, like asthma, for instance, then you would file for an increase for that condition. If you have some other respiratory issues that you've come down with, like chronic rhinitis or chronic sinusitis, then you would file separate claims for those if you've been diagnosed with those conditions, which are presumptives as well for airborne hazards and burn pits. And from that public health .va.gov or from that Exposure Ed app, there's a list of all the presumptives for airborne hazards and burn pits and all of the other presumptive exposures as well. Hope that's helpful. Wanda, you're muted.
Thank you. All right, so back to Rhonda. What challenges has the VA faced in implementing the community care program, and how is the VA addressing these issues to ensure continuity of care for veterans?
Great question. So like I mentioned in my slides, community care program is not new to the VA. We've been doing this since 1945. All the Mission Act did was revamp what our current program does. So and it did this by introducing new standards and eligibility for our veterans, which has, of course, increased that community care footprint. Over the years, it's been enhanced with the needs of our veteran population. The challenges faced in implementing our latest version of the community care program mostly comes down to our network adequacy and being able to build a robust network of providers, specifically in our rural communities, kind of like what I just mentioned in the previous question. Phoenix
Mhm.
Community Care does work closely with our third-party administrator, our TPA Tri-West, to assist in building this network of providers. Phoenix also works with our tribal partners to help bring care and access to the VA with our native population in their own communities. Um, so really, it just comes down to trying to build that network of providers and getting these providers to these areas that are needed, or being able to get the transportation for these veterans from some of these smaller communities out to, say, down to Phoenix or even Payson for an appointment. One thing that the VA has done is we are contracted with Be Connected to assist in some of those transportation needs and some of those needs out in our rural communities. So if you are a veteran that does live in a rural community, I always suggest reaching out to Be Connected if you have an appointment and you can't travel to it on your own. Reach out to Be Connected and see how they're able to assist as well, because they can arrange rides to and from appointments and so forth for that.
Great, thanks, Rhonda. We have another sort of question. Amendment filed many more lung issues. So why is it taking so long? And that's a disability issue again, and that's really with VBA. So you have to go to VBA to kind of get the answer to that. Okay, all right, so next question. For Arena, how has the implementation of free emergency mental health care under the PACT Act impacted veterans in crisis?
So one of the biggest things we want to do is reduce barriers to care. That can be via the lack of education and knowing what's available to them, and not having them worry about bills over their care. There's some that, like I mentioned, they'd rather just not go to the hospital or get care because they're worried about the financial stressors. And we want to ensure and remove that barrier, all those barriers then. And also educate them that they have a lot more options to get care on their suicidal crisis, whether it's in the hospital, outpatient follow-up. There's also an ability to extend care if necessary. The last thing we want is for these veterans who are already in crisis to not get help and see these bills and become even more distressed. And that's where the education comes in, where we want as many of these vets to know this, because that's incredibly stressful. Because we've already had some vets who've gotten thousands of dollars worth of bills, and they call the patient advocate, and we're able to help them and resolve them. It's a team effort with other departments. We have a clinical review team, and we all get together to look at where or what went wrong possibly. Sometimes it's just that it hasn't been billed correctly yet, or it was billed to their insurance first. So it's, as long as they call the patient advocate and we can educate them to that, then, and the more veterans know, then I feel like that's going to help reduce a lot of these crises. We just have to get the word out there.
Great, thanks, Irina.
Thank you.
So Kathy, how is the VA leveraging the PACT Act to advance research on the long-term health cares of toxic exposures among veterans?
Well, we have a group of research scientists that are working hard on doing different research studies on different exposures, different areas. And there's money that has been out through the PACT Act given, and the war-related injury, and that group is doing some studies. There's also they contract out to groups that do some research on that as well. So there's lots of research going on. And if you go to that website, the www.publichealth.va.gov, they actually have some studies listed that you can read for some different exposures on that website. So interesting. And there probably are some on the risk website as well. So I put both of those in the chat, and Stacy put them in for me. So lots of great information going on. And so the PACT Act, was a huge act. And, there was money given to our research scientists to delve into those exposures. And it's a huge push for the Congress and for the VA to, for a long time, I think it was overlooked. So I'm so glad for our veterans that they're really giving a big push for our veterans to really study those toxic exposures that have affected their health in negative ways. So,
Yeah, the VA, one of the largest healthcare systems in the world, really, I think, has a bank of research that I always tell people, go look at some of the studies that VA has done so that you can have an understanding of what healthcare issues you might have and have a better understanding of it, so that you're more prepared when you go see your doctor, your primary care, to actually ask good questions about your health. Right?
Yeah, and I want to say one other thing, because there's kind of a misunderstanding, I think, about the research and how it connects to the condition. So, like for instance, I'll give you an example of Agent Orange. So they can't say that Agent Orange has actually caused diabetes or caused these different things. But because our veterans have those conditions in greater numbers than the general population, we're going to err on the side of our veteran. And so there could be an association, not necessarily a causal relationship. And because there might be an association with these conditions, with these exposures, we're going to give it to the veteran. And so with most exposures, except for, some of those really serious ones with the radiation or the Camp Lejeune water, that cause those horrible cancers, there's not really a causal relationship, but there's an association because our veterans have those conditions in greater numbers than the general populace. Does that make sense? I hope. Yeah.
I think that makes total sense. I always think that people should go in to see their healthcare providers with some sort of understanding, to be able to talk to their provider in a way that they can get the answers they need. And so, I totally understand what you're saying, and result that, Agent Orange may or may not have caused cancer. We don't know. But again, we defer because we know veterans have suffered in these high numbers. And so,
and go for illness. I just listened to a webinar today, and our male veterans that were in Iraq and Afghanistan, many greater numbers than the general populace with Gulf War related illness, which is, a hard one to diagnose. You have to have chronic symptoms for 6 months, like 3 out of 6. It's very complicated and so hard for our veterans sometimes. But stick with it and put those claims in, so they're studying a lot on that Gulf War illness right now. So,
prepare yourself. That's what I say. Thank you, Kathy. All right. So, Rhonda, how has the Mission Act influenced the modernization of VA healthcare facilities, and what future plans are in place to further improve infrastructure?
So let me preface by, when it comes to the Mission Act, I'm much more versed on community care side than I am at the facility. So I actually did reach out to our deputy director of the Phoenix VA to get his insight on this question. And his response is the Mission Act supported the Air Commission that looked at sites like ours to determine that we needed additional locations and a new facility to meet veteran needs. It also supported the staff hiring and recruitment through improving tuition reimbursement from 120,000 to 200,000 over 5 years, as well as it supported the caregiver program expansion. Again, this came from our deputy director. Unfortunately, I'm not that well versed on the facility side as I am on the community care side.
Well, that was a good answer, I think. I think you did a good job. Because it was, you know, I was the director of the Arizona Department of Veteran Services when that commission came through. And it created quite a bit of controversy because we actually took a couple clinics away as well as adding other things. And that was around Mission Act. And so when we're talking about these acts, it's not just one little thing, it's a plethora of things in the law and legislation that need to be addressed. We're talking mostly about healthcare here, but there's other components of all these acts that are affecting veterans in different ways. All right, so let's see, what else do we have? All right, Irina, what role do community organizations play in supporting the VA's effort under the PACT Act, and how can these partnerships be enhanced?
That's a good question. And I got on board a year ago, and that was one of the things I was thinking about, because basically I had to start from the ground up in trying to promote this this new act. So people like first responders, law enforcement, they're some of the first crisis responders that interact with veterans. So they're definitely on my list of those that need these the collaboration from and support from. And networking, outreaching in the community providers, I've learned a lot. And who the veteran advocates are, the veteran organizations. Word of mouth is definitely powerful. So networking, I love working with ASU. I didn't realize how many veterans, student veterans there were. So we want to reach out to them too. They're a lot of them are young, probably not familiar with the VA, not familiar with anything the VA, any of the programs we have to offer. So that's a big thing too, because word of mouth from the student veterans can get out in the community as well. Also reaching out to healthcare providers, not just mental health, because some veterans who end up dying by suicide aren't even connected to mental health. And so reaching the medical providers is important too. A lot of these veterans, there's a pretty high number, I think 41%. I need to look that up, but the issues with them are the pain, physical and emotional and mental pain caused by chronic medical issues, like pain and of course cancer. And so I think a lot don't realize that that's kind of a silent part of the population that also needs to be monitored and constantly have the risk assessment done on them. So yeah, the partnership with the community is so important because we're collaborating with them. And yeah, and Stacy put community care also works side by side with us. So I get a lot of help and education by collaborating with our community care as well, the VA's community care side. So yeah, a very, very important role. And hopefully just by going out and doing outreach and networking, that can enhance those partnerships.
Great, thanks, Irina. Stacy, do we have another poll to put out? There it is. Have you registered for the PACT Act?
So that's an interesting question. Like, what does that mean?
Well, it really
Because I
means
don't think you don't actually register for the PACT Act.
right, but you do register within the VA around toxic exposure, and so that's an easy way for people to understand it.
Okay, got it.
Yeah.
Okay.
All right, we got more that said no than said yes.
Well, I got to get your toxic exposure screening done.
Yes. So that's
And I will
what, you know,
say that
ahead.
the PACT Act actually has brought a lot of new veterans to the VA as
Yes,
well.
Mhm.
So when we're
absolutely.
doing these outreach events, me and Kathy do them on a regular basis. They come in and they do their toxic exposure screening, and right from there they go right over to our eligibility department and sign up for the VA at the same time. So it has brought a lot more veterans into the VA than what we've had in the past.
Yeah, someone told me the other day that now almost 80% of the 18 million, however many veterans there um, are um, are could be enrolled in the VA potentially based on the PACT Act. And so I thought that was wild and it's sort of tremendous that every veteran could have access if they have an illness or injury. I thought that was really great. And so hopefully that will continue and we'll get more veterans who need support, right, to enroll in the VA. All right, so looks like our time is ending. We have no more questions in our question bank. Do we have any other questions out there that anybody wants to ask before we close off today? Oh, there's one question. Where can I enroll for the 2 courses that were mentioned earlier for nurses? And I think it was the provider training.
Yes, well, it's for nurses too, for registered nurses.
Mhm.
And you can go to the risk. Let me get out of where I am. And I think you can find it on, let me just put that in, see if I can find it by Google real quick. Oh, provider and clinician training. So I just put in WRISC, and there was a button for provider training. So you can find it right on their website and get that training. So there's a certification 1 and certification 2.
And it does look like Stacy did share that link for the risk site, and she just shared it again.
Yeah. So it's in the chat. All right, there doesn't appear to be any more questions. So you can't hear clapping for you, but we are so grateful for you guys to come and visit us from the VA and talk about these really important issues for our veterans. And I really believe that there are a lot of veterans out there who really don't understand how all this works. And we want to make the information easy for them and help them understand where they can go if they have other questions. And so now you've given them all these links to go to, and hopefully that will help them find out the information that they need, especially if they don't remember what you just told them. And because it is important, I think more and more veterans do need the VA care. And so thank you, ladies, for doing this for us. We really appreciate it. And I think we got like all these questions just came up. Hold on. All right.
And I would like to just say, if you're a veteran and you have not enrolled at the VA, please go down and get enrolled. You never know when you're going to need the services. The VA, it's free healthcare for the veterans. I'm a veteran myself. I'm also rated disability with the VA. If you're not enrolled, go down and get enrolled. that's one of my key takeaways from today.
I second that.
Yep, get enrolled.
Yeah.
I fourth that.
All right, well, ladies,
Hey, just one real quick thing. Like, I'm such a cheerleader for the VA. Google studies. We so beat out private sector in care for our veterans by a lot. I'll just mention one about our emergency room care. If a veteran goes to a VA emergency room versus a private sector emergency room, their chances of living within the next 30 days is 20% higher at the VA. 20% for Black American veterans, 25% for Hispanics, 23%. VA gives great clinical care. Try it out.
great. That's a great way to end. Thanks, Kathy. Thanks, Irina. Thanks, Rhonda. We appreciate your time with us today. And who knows, we might ask you back for some more information.
Sure. It was a
We love it.
pleasure.
Thank you.
Yes, take
Thank you
care.
so
Thank
much.
you.
Thanks so
Bye.
much.
Bye.
Good night.
Night.